From a car seat belt to a bike helmet, parents act to protect their kids from harm at home. When it comes to pain, it's no different. In your child's medical care, you have an active role to play on the healthcare team to prevent and treat your child's pain. Welcome to the team. As a parent, I understand how intolerable it is to see a child in pain. As a pain nurse specialist, I'm passionate about preventing needless suffering in children, and I'm honored to welcome you as an active member of the healthcare team. Babies cannot tell us with their words how much they hurt, but science does tell us that the pain they feel is harmful. That's true for older children as well. When it comes to pain, if it's not treated well or not treated at all, the consequences to our bodies and our minds can last. But parents don't have to stand by and watch their kids in pain. The next time you bring your child to the clinic for shots, or to the emergency department for an injury, or even into the hospital for treatment, first, speak up. Make it clear that you expect pain to be prevented as well as treated to the degree that that's possible. Second, partner. Doctors and nurses know pain management. You know your child, so get together and make that best game plan. And third, advocate. At any time, you have the right to stop and make a change in that plan if it's not working for your child. Parents are our best teachers. Let's learn how.
We started coming to Seattle Children's in 2006 when Zoe was diagnosed with a serious chronic medical condition. And when we first started coming, we didn't have really any information about how to prevent pain for her or even what she was going to go through. But her treatment really involved a lot of procedures and a lot of needles. When she used to have IVs placed, it was a really horrible experience for everyone in the room. She screamed and cried through the entire thing, and it usually took two people to hold her down so that she could be still enough to have the IV placed. And I would cry the entire time that this was happening, and I felt like a terrible mom because on one hand she needed the IV. I mean, she had to have that IV put in, but it just seemed like it was torture. And I think I felt really helpless to change it for a long time because I didn't have the tools and I didn't know what could be done. I couldn't picture how it could be. And when you can't picture how it can be, it's pretty hard to find your voice. Now things look really, really different. So when she goes for a blood draw or she needs an IV placed, we make sure that we have topical numbing cream on her for about an hour before she goes in. But when she's having an IV placed, we'll oftentimes bring a stuffed animal or a doll so that she can see it done to the doll or do it on the doll herself before she goes into the experience. And so we are kind of in awe every time she has a procedure now because we're watching her do this with little or no tears at all. And it's just amazing to see how much of a difference it has made in the last few years to work really hard on these methods and these techniques.
Do you want to sit on mom's lap today or not?
I think that providers sometimes feel just as panicked as parents when there's suddenly a kid screaming. Like, okay, let's just get it done, right? And I think that comes natural to everybody in the room because we just want to stop the screaming. We want to make it end for them. We want it to be over with. And so I do think it's important as a parent to be able to say, let's try a different way. Let's try a new idea. What are your ideas?
Charlotte was born with a progressive neuromuscular disease. And we began coming to Children's when Charlotte was 3 months old. When something catastrophic happens, whether it's an injury or a diagnosis that's unexpected, that there's that feeling of having sort of the parental rug pulled out from under you, and you don't know what's your job anymore.
When you first start into this, you defer to the people who have the degrees and are here and are the professionals. It becomes clearer and clearer as to what their expertise is and what yours is. And our expertise was Charlotte. Nobody on the planet knew her better than us. And that's where we found our moments of saying we have to share what we know, because even though these folks know their jobs inside and out, will never be as good at what they do, they'll never be as good at what we do. And that's knowing our daughter.
It's like a muscle that is stiff. You have to stretch it out and warm it up, and it gets, you do better with experience and time.
That's where we saw our opportunities to speak up, and we did, and we're glad we did.
Well, Ricardo born with this chromosomal abnormality, and because of this issue, he has a lot of complication or medical care, complicated medical care. I came with the culture that doctors knows the best, and parents, well, we are just parents, and so I didn't know how to speak up for him. I thought, well, the doctor knows exactly what they are doing. They are the professionals, but I was in pain in myself when I saw Ricardo in pain, and when some procedures, it was painful for him. And I just holding myself, trying to be brave for him, but doing nothing, because I didn't know that I have that right or that option, that choice. We as parents, we know our child the best. And that is so important for us to speak up and to say, you know what, this works and this doesn't work for my son or my daughter. And why don't we try this way? Something that I have learned through my journey with my son is that it's okay for the parents to be the one that they ask, or the first one to ask for something to relieve the pain. It's perfectly fine to do it. You can do it anytime, and I think the response from the providers will be great.
Nobody ever wants to see a child suffer, and we feel that as much as anybody else. So the common ground that we have is that we're all interested in your child and the development of that child and making their encounters with the medical environment as positive as they could possibly be. So we've got the expertise on the medical side in terms of evaluating and treating different conditions and states. You, the parent, have the expertise of your child, and it's only through a true partnership where those two areas of expertise are combined that we can do the best we can by any given child.